I think many of us have really heard about the impacts of fentanyl in our communities. It's such a prevalent drug in the unregulated drug supply. Fentanyl is a synthetic or man-made opioid, really easy to manufacture, and it's just really integrated itself into the unregulated drug supply. Has really been driving drug overdose deaths across the United States for the past several years, since around 2018. And we have since then really actually seen a shift in how people who overdose on drugs have been overdosing. In the past, most overdose deaths were related to injection drug use, but the CDC actually published some data recently that shows that has shifted to where smoking drugs is now the most common route of use associated with drug overdose. And so I think that's really essential that we talk to our patients and our clients about, because they may feel like, when you smoke a drug, there's less risk for drug-related infections like HIV and hepatitis C, skin abscesses and wounds, which is important. But what we're seeing is that many people are overdosing and dying from smoking-involved drug use. And so just really educating our clients and our staff that people can overdose when they smoke a drug, whether they're intending to use an opioid or not. Maybe they're intending to smoke cocaine or methamphetamine, or smoke a stimulant along with an opioid. Many of those drugs contain or are mixed with fentanyl. And so making sure that people who smoke drugs or use stimulants have access to naloxone and know how to use it. And also making sure that our staff and clients are aware of other emerging drugs in the drug supply. So isotonitazine or ISO or nitazines are another kind of emerging drug. We don't have a ton of data on the prevalence of these drugs, but they are opioids really similar to fentanyl, very potent opioids. They can cause an opioid overdose, just like any other opioid. And so some things people can do to stay safe are to check their drugs with test strips, like fentanyl test strips or nitazine test strips. And then xylazine or tranq is another emerging drug that we have a bit more evidence that it's more prevalent in the drug supply on the East Coast, but increasing prevalence that we're seeing. And this is an animal tranquilizer that is used in veterinary medicine and is also being added to the unregulated drug supply. Xylazine is not an opioid. It's a sedative like clonidine or ketamine, more similar to those drugs. And what's really concerning is we're seeing increasing drug-related adverse outcomes due to xylazine. It's thought to be related to reduced blood circulation. And if people use xylazine, they can fall asleep for very long periods of time. And if they're lying on one of their limbs in a strange way, it can lead to circulation kind of getting cut off in a limb. And we're seeing these really awful skin wounds, like ulcers and wounds that can progress to necrosis, especially on the arms and the legs. And it doesn't matter what route people use a drug that contains xylazine, and they don't have to be injecting it. They could smoke, inhale, rectal use, but they can obtain these really awful wounds. So just being aware of what the signs and symptoms of xylazine exposure looks like, and making sure that people get wound care if and when they have these types of wounds, because they may not respond as well to cleaning with certain types of solutions, and they may need, specialty kind of wound care services to get better. So just being on the lookout for those types of signs, and knowing that the drug supply is not really safe. People, use drugs and it's not really just what they think they're using. It often has a whole range of other things in there. So xylazine test strips or drug checking services where people can go actually get their drugs tested. From a community perspective, we all just, we want to keep each other around. And there's been so much loss of life these last few years, especially drug related loss of life. And I think so many of us have really been impacted by that. And so just strategies that we can all come together behind to keep each other safe and alive is really essential as we kind of move forward.